The COVID-19 vaccine rollout is currently underway, as we know. It's reported that thousands of teachers and other support staff will be getting their jabs. So far, the Health Department has administered vaccines to around 1.3 million healthcare workers and our elders. So who's next in line for the vaccination? Let's discuss this now with Bhekisisa Centre for Health Journalism's editor, Milan. Mia, good afternoon. Thanks so much for your time. So I suppose, yes, that is the question. Who is next?
So the Health Department, as you may know, strictly uses age as a measure to prioritise people. So the next group would be 40 plus. I'm talking about largely mass vaccinations. There are some smaller groups in between. So in terms of 40 plus, the goal is for 40 plus people to start in July. At the moment, we don't have enough vaccines. As you may know, we don't have our J&J vaccines. So we don't have enough vaccines to really make that goal. Because if we look at how many people we vaccinate at the moment, with Pfizer, we have vaccinated about 900,000 people so far. And we, according to the Health Department's information, we need to have vaccinated 70% of them before we can start off with people of 40 years and older. And if you calculate how quickly we are going at the moment, we do about 70,000 vaccinations per day, but almost nothing over the weekends. So if you times that by 4, then and you work out how many do we do in a month, then it comes to about 1.4 million, and we've got 5 million people of 60 and older. So we wouldn't really reach that goal unless we receive our J&J vaccines.
All right. So where are we with that at the moment in terms of getting those into the country?
So we already have J&J vaccines in the country. We have our first 2 batches, 1.1 million and 900,000, so 2 million altogether, waiting for us at Aspen in the Eastern Cape. But we can't release them because the key ingredient that has been used to make those vaccines with are under investigation, not the actual agreement, but some of the batches that were made in a US factory. And our vaccines here in South Africa, there are 4 batches that's being investigated by the Food and Drug Administration in the United States. And our vaccines have been made with all 4 of those batches. So they were going to make an announcement on Friday, but then postponed it and said they will make an announcement this week. And what could be possibly here? We could hear that some of those batches are okay and some are not. We could hear that none of them are okay, or we can hear that all of them are okay. So that will really determine whether we are able to use those vaccinations for a national rollout.
So Mia, then I'm sitting here wondering, how are we possibly going to manage all of this going forward? I mean, we still have, yes, I'm sure that there are so many healthcare workers that are still waiting as well. We still have many of our 60 plus, those elders who are still waiting. Many I know haven't even received their SMSs yet. We still need teachers to be vaccinated. And like you say, the 40 plus is going to be quite a significant group. So how do we manage all of this?
So we can only move faster if we have more vaccines. If we don't have more vaccines, we can't scale up. According to the Health Department, if we had our J&J vaccines, we could vaccinate about double the number of people that we're vaccinating at the moment. So if we can't get the J&J vaccines, say the FDA says none of these vaccines are okay to use, we're going to have to look at procuring more vaccines, more Pfizer vaccines or more J&J vaccines, or there are 2 other vaccines that have applied with our regulator for permission to be used here, and that is the Russian vaccine, Sputnik 5, or the Sinovac from China. But neither of those 2 vaccines have been approved yet, so we can't yet use them here. So we would definitely have to look at alternative ways of getting vaccines. But as you know, vaccines are in short supply across the world, and it's not just South Africa that can't use its J&J vaccines. It is several other countries, several European countries, Canada. Everyone who has vaccines that were made with those 4 batches have been told you can't use them. You have to wait for us to investigate if they are okay, if they are contaminated or not. So it's going to be a tough way ahead. What we do know is that J&J has offered South Africa about 500,000 additional vaccines that will be used to vaccinate not just teachers but everyone working at primary and high schools. But we don't yet know if we will get that batch, because that batch has also been manufactured with some of the ingredient batches that are under investigation. So the announcement of the FDA this week will determine whether we can get that batch or not.
All right, so how does this impact then, and I know now I'm shifting to the Pfizer vaccine as well, but how does this impact those who would have to at some point, maybe soon, soon have to go back for their second shot. I mean, I would imagine that would turn out to be a bit of a nightmare. We've got a group that is now being held back. We've got a group that is going to be due very soon. Those who've had their first Pfizer shot might most likely be called in the next couple of weeks, maybe, for that second one. What happens then?
So we give our second Pfizer shot 42 days, about 6 weeks after the first shot. So if you work it out from the 17th of May, it's around about the 28th of June that the first batch of people would need their second shot. Now, we know that Pfizer is going to give us more vaccines after June, and so it sort of coincides with that time. The reason why there will be more, the Pfizer batches will be more readily available after June is because Europe and the US would have vaccinated large proportions of their populations already, and then there would be more vaccines available for the rest of the world, including South Africa. So the good news is that we will have more supply then. We also know, for instance, that by the end of June already, at the moment, in May, our batches that we received of Pfizer on Sunday nights were about 300,000. Then in June, that doubled to about 600,000. And by the end of June, that will be 1.3 million on a Sunday night. So we should have more vaccines. And how will it work for people with their second batches? The EVDS will schedule them, according to the health department, for a second vaccine, and the number of vaccines that we have in the country will be allocated accordingly. So they're not going to take vaccines that we get now and keep half of them so that they can vaccinate the second doses. They will use them as they come in.
All right, Mia, you're the lady in the know, so tell us, should we worry while we're waiting? We're playing a bit of a waiting game, aren't we? Should we worry, especially with the 5,000 plus cases coming through daily every day now?
Yes, of course we should. Of course, the ideal would have been to have had a large proportion of people vaccinated at this stage, but there aren't enough vaccines. And if the world doesn't have enough vaccines, I don't know what else we can do. So yes, we can try and obviously procure from more than one brand so that we can get vaccines in quickly. But at the moment, we are constrained. Our biggest challenge is the supply, the availability of vaccines across the world. If we are able to get some of our J&J vaccines this week, that will obviously help significantly. And the J&J vaccinations are also simpler and likely to go faster because there will be several more sites then open for them. We can't do Pfizer and J&J vaccinations at the same site. We can only have one site per vaccine because it's too complicated. You know, they use different types of needles. The nurses get trained in different ways. They get stored in different ways. So all we can do at this moment is really hope that we can use some of our J&J vaccines, and if we can't, then we need to really look at other ways, other brands to procure vaccines from.
All right, Mia Milan, thanks very much. I wish I could say you were the bearer of good news, but not so much. So, yeah, that's where we are at the moment with our vaccine rollout, and just when we seem to be getting things right at some point, there's always a spanner that gets thrown into the works. Well, we'll be back after this.